Welcome back. Dr. Karim Ali joins us now. He is the Director of Infectious Diseases for Niagara Health. Dr. Ali, are we beginning to learn a little more about the long-term effects of COVID-19?
Yes, we are. And in fact, there is more and more literature, there is more and more reports coming out that sort of tries to move you away or makes you think a little bit more that this is not just death, right? And we've been saying that before. It's not just about the death, it's about the life after COVID too. In one of the studies that was published in the British Medical Journal, what they showed is they followed people after their diagnosis of COVID and discharge from the hospital for 6 to 8 months. 76% of them had at least one symptom that affected their quality of life. Now, the most common was fatigue and the lack of energy. The other was shortness of breath. And, so symptoms like that have lasted for long. And this entity called the Postcovid syndrome or long COVID or chronic COVID is now being actively studied.
Those fatigue symptoms, are they related to the respiratory attack?
There were some people who actually had just shortness of breath, right? So as their main complaint. But this fatigue was all over, right? Fatigue is defined like it's all over the body. The mechanisms of this are being understood now. And, this is different than other viruses, right? For most people, we just used to think, oh, it's just a head cold, it's going to be fine. But no, there are complications with it. We have seen young people coming in with strokes with COVID infection or in the immediate COVID period. It makes your blood really thick. So it's not just about the death, it's about the clots and, all the other things that go with it.
Do we have any idea how to treat some of these symptoms?
Yeah, so if it's a blood clot, then you treat it with blood thinners, right? And this is done under supervision of physicians, doctors and the team. Fatigue and all, there are, people are trying to see if there is rehab or something that would help in that situation. But again, too early to know as to what would work and what wouldn't in this situation.
We've heard a lot about people losing the sense of taste, losing the sense of smell. Are there studies showing that that is a long-lasting effect now as well?
So more than 75 to 80% of people do regain their sense of taste and smell within 2 to 3 weeks. Sometimes some of them last a little bit longer.
A question that I might have here, Dr. Ali, is once someone is vaccinated, would that alleviate some of those symptoms? Or maybe, even if you were vaccinated and eventually did contract COVID-19, would those long-term effects maybe be alleviated?
Oh, so excellent question. And we try to dig into this. So there are two parts to this, right? So first you're saying, let's say, I had COVID today and 3 months down the road or something, I still have these symptoms and now my turn comes up, I get vaccinated. Do my symptoms go away? It doesn't look like, because it's actually not the virus now, it's the body's mechanisms that are doing it. Again, vaccines are just being rolled out. So we are just trying to determine whether these would reduce the severity of these symptoms. So we don't know. The second part of this question is, let's say I haven't had COVID, I'm in a high risk situation. If I get vaccinated, do I avoid getting the chronic, the long COVID, the chronic COVID? Again, no studies have shown that for sure, but I am there is consensus and confident that that will be the case. It will prevent you from getting those chronic symptoms and all that.
With the complications of the variants that we're all aware of now, does that mean that we need further studies on the different long-term effects of those variants?
The virus in that situation is the same, right? I try to say, for lack of a better analogy, what this virus has now done is basically gone to an esthetician and gotten a makeover. Yes. Okay, but it's a makeover of just the head part. not the whole body yet, okay? And that is the main part that kind of binds the virus into the human cell. It's the clinical illness can be more severe, but we don't know. It's too early to know whether the chronic effects are also more than we know.
You mentioned off the top that these studies were in Britain. Are there studies taking place here in Canada as well?
As of yesterday, I think we stood at about 500 and change variants all across Canada, and 303 of them being here in Ontario. The second province is Alberta, 176 or so, if I'm not mistaken. Now, right now, it's too early. Right now, all the focus is to do surveillance to figure out what the disease burden is in the community. I'm sure people would be thinking as to trying to understand it for later.